One thing I want to go over is different techniques for securing things like dialysis lines into place. There's a few different techniques that can be used. One that I want to show you is basically something that's kind of like a reverse vertical mattress suture. I think you can also use a vertical mattress suture. However, I've seen conventionally that people do this reverse style where you are suturing near the actual exit side of the tunnel catheter, and what they do is they do a throw kind of, near, and then they go far, and they tie to kind of cinch up the exit site, and then they tie around the tube. All right, so I'm going to show you this stitch. We can use something like 3/0 Vicryl. That's pretty commonly used. So you can kind of, and again, I think a lot of people call this a vertical mattress suture, but it's important to realize that it is kind of the opposite. So we can do our throw here, kind of our near, and you want to be very careful that you don't actually suture or poke the actual catheter with your needle, because you are going to kind of be in that area. All right, and now you'll do kind of like a backhanded throw. And now you can actually even use the suture here to lift up the skin. Okay. And then we can do our bigger bite where we go a little bit further, and then we come out a little bit further as well. Okay. A little hard with the towel here. Okay, and we just want to be careful that we don't lock our suture. And now, it's good to have some length because we're going to tie around the tube as well too. But at this point, you can cut the needle off. And you can kind of bury your sharps. But what we're doing here is kind of closing up our site a little bit. Okay, and you can do 2 of these if you really want to. You can do one on either side. Oftentimes I think 1 is plenty, but it's just to kind of cinch the site around the tube. Okay. And now what you can do is just go around the tube here, and you can kind of secure it to the tube, and tie around the tube as well too. So this is just one technique for securing the tube in place. But again, there are multiple ones. But yeah, here we go. Now we're just tying around the tube. Here. Problem is the towel moves, but that's okay. And if you want to, because we have so much length here, you can go around the tube multiple times. But really, once you kind of suture a couple times around the tube here, you've kind of closed the skin and secured the tube in place. And now the tube should not really be moving back and forth. It should be pretty secure because you've kind of secured things. And then because this is a dissolvable suture, in about a week or so it will dissolve, and the cuff here will kind of get a little bit of a fibrin sheath around it, which will keep the catheter in place.